17 medical societies are taking aim at a variety of routine practices that they say are often inappropriate and frequently overused. The groups released their lists of medical don'ts as part of the latest installment of the Choosing Wisely campaign. That campaign, now about a year old, was created by the ABIM Foundation. It joins together medical societies, consumer organizations, employer groups, and unions. The goal is to get consumers and physicians to work together to agree that when it comes to health care, more is often not best, and sometimes may even be harmful. Christine Castle, who is president and CEO of the ABIM Foundation, explained Choosing Wisely's goals at a recent press briefing in Washington.
Patient empowerment and appropriate care is what Choosing Wisely is all about. It's about the conversations, informed conversations between physicians and patients about the right care at the right time for the right patient.
Dr. David Nielsen of the American Academy of Otolaryngology said that Choosing Wisely is not about telling physicians they can't ever perform any of the tests or procedures on the lists. It's more about weighing the evidence and discussing the options.
These events that we're describing are not never events. We're not saying you should never do this. We're saying it's done too much, or it's done inadequately or inappropriately, and that it needs to be discussed and talked about.
I sat down with Dr. Glenn Stream, board chair of the American Academy of Family Physicians, to talk about Choosing Wisely and its implications for doctors.
So one of the big questions is, how will you change physician behavior? Because there's no financial penalty or disincentive for not following the recommendations.
So the recommendations really are just guidelines, and yet they are very strongly evidence-based guidelines, and physicians at their core want to do what's best for their patients. And so we have some element of getting this information out to the physicians to inform them if they're not currently already aware of these. But in many cases, this is information physicians are really already aware of, and what they need is awareness amongst their patients that in fact these are circumstances where more in the way of testing or treatment is not in their best interest and potentially could even be harmful, and make it easier to do the right thing sometimes by doing less.
So we heard this morning that Consumer Reports and AARP and even Univision are reaching out to their viewers, their readers, about Choosing Wisely. And you said that you'd heard some of these conversations are going on in the exam room. You've heard from the membership. What kinds of things are you hearing?
So it's really important that these folks are members and participants in this initiative. They have the expertise and the credibility in addressing a public audience in familiar terms and sort of outside and independent of the healthcare delivery system. And so I have personally seen where patients have come in with issues that are on our original top 5 list. One is about antibiotics and mild to moderate sinus infection, and another is about imaging and low back pain. So I have in fact seen patients who've come in, evaluated them, identified them to be in that category of a minor, mild to moderate sinus infection of less than 7 days duration. And one of our guidelines, again very evidence-based, is that's most likely a viral illness, is going to get better on its own, and that antibiotics are not going to be helpful, and that the patient had already read that information in Consumer Reports, was aware of it, and so it wasn't so much the dynamic that had happened in the past, which is trying to convince a patient that they didn't need antibiotic.
So how are you going to be able to measure the impact? How are we going to know that Choosing Wisely is really making a difference?
It's a great question, and it was a good part of the discussion this morning, and it's not specifically a part of the Choosing Wisely initiative itself. Our academy is not really a research institution. Certainly we would encourage folks to do that.